Hello, I'm Dr. Greg Chernoff, and I'd like to talk to you about the very popular procedure called liposuction or liposculpting. Fat is of two types. White fat is like chicken fat, which is very loose, or brown fat, which has more fibrous tissue in it. And we know that brown fat doesn't oxidize with exercise as well as white fat does. The highest accumulation of brown fat in a woman is abdomen, hips, and thighs. In a male, it's abdomen and love handles. So these are the most common areas in men and women that I perform liposuction on. I typically do not advise liposuction for a patient if you haven't been on some form of a diet for at least 6 months, if you haven't been exercising, particularly with a personal trainer. We all have a long list of excuses why we don't do enough exercise. If you are a candidate for liposuction, we'll go over with you the procedure and what a very meticulous operation it is. It's typically performed by making tiny incisions that are hidden, that are usually no more than 1/4 to a half inch large. They're usually in the groin, in the belly button, around the turning edge of the hip and the thigh. I do this with you asleep. It usually takes about 2 hours to do. You spend the first night with us from a safety standpoint. You go home wearing a compression garment that you typically wear for 6 weeks. And then it takes about 6 months for all of the subtle shrink wrapping of your tissue to occur. So I look forward to meeting you for a consultation if you have any form of excess fat and you're wondering what your options are.